Before you spend thousands of dollars on dental implants, there's something you absolutely need to know. What I'm about to share could save you from months of pain, unexpected complications, and serious regret. I'm not here to scare you, but someone needs to tell you the complete truth about what can actually go wrong with dental implants. So if you're considering this procedure, or if your dentist just recommended it, stay with me until the end, because what you're about to discover might completely change your decision. Introduction. If you're new here, I create educational content about dental health and medical procedures to help you make informed decisions. Today, we're diving deep into dental implants, specifically the side effects and reasons why they might not be the right choice for everyone. Now, don't get me wrong, dental implants can be life-changing for many people. They look natural, function like real teeth, and can last for decades. But here's the thing, the success stories are everywhere, but the potential problems, not so much. That's what we're covering today. Make sure to hit that subscribe button and turn on notifications because I'm committed to bringing you honest, research-based information that helps you protect your health and your wallet. And if you find this video helpful, give it a thumbs up so more people can see it. The painful reality, immediate complications. First, let's talk about what happens right after the surgery. When you get a dental implant, your dentist is essentially drilling into your jawbone and inserting a titanium post. This is major surgery, and your body will react to it. Pain and swelling. Most people experience significant discomfort for several days, sometimes weeks. We're not talking about a little soreness here. Many patients report throbbing pain that keeps them up at night. The swelling can be so severe that your face looks completely different. Some people can't go to work for a week because they simply can't speak properly or look presentable. Infection risk. Here's something critical. Anytime you have surgery, infection is a possibility. With dental implants, if bacteria enter the surgical site, you could develop an infection called peri-implantitis. This condition can cause severe pain, bad breath, pus discharge, and in worst cases, the implant might need to be removed entirely. Studies show that infection rates can range anywhere from 5 to 10% of cases. Bleeding and bruising. Excessive bleeding during or after the procedure can occur, especially if you're on blood thinners or have certain medical conditions. Some patients experience bruising that extends down their neck and chest, which can be both painful and alarming. The recovery period is no joke, and if you have a low pain tolerance or a busy lifestyle, this is something you really need to consider seriously. Nerve damage, the hidden danger. Now, this is where things get really concerning. Your jawbone contains important nerves that control sensation in your lips, tongue, chin, and gums. During implant placement, if the dentist drills too deep or places the implant incorrectly, these nerves can be damaged. What does nerve damage feel like? Imagine constant tingling, numbness, or even sharp burning pain in your lower lip or tongue. Some patients describe it as feeling like their mouth is constantly asleep, like when you get anesthesia, except it never goes away. You might lose the ability to taste food properly, or you might accidentally bite your tongue or cheek because you can't feel it. Is it permanent? In some cases, yes. While minor nerve irritation might heal within a few months, severe nerve damage can be permanent. This means you could live the rest of your life with altered sensation in your mouth and face. The scary part? This complication is more common in lower jaw implants because that's where the main nerve runs through your jawbone. Some studies suggest nerve damage occurs in up to 5% of lower jaw implant procedures. Those might sound like small numbers, but if you're that one person, it becomes your entire reality. Implant failure, when your body says no. Here's something that might surprise you. Dental implants can fail. Osseointegration failure. For an implant to work, it needs to fuse with your jawbone in a process called osseointegration. But sometimes your body simply rejects the implant. The bone doesn't grow around the titanium post and the implant becomes loose. When this happens, the entire implant needs to be removed and you're back to square one, except now you're thousands of dollars poorer and have a damaged jawbone. Who's at higher risk? Smokers. Smoking reduces blood flow and healing. Diabetics. High blood sugar impairs bone healing. People with autoimmune diseases. Those who grind their teeth at night. Individuals with poor oral hygiene. The timeline? Implant failure can happen immediately after surgery, or it can happen years later. Early failure occurs within the first few months and is usually due to infection or poor bone quality. Late failure can happen 5, 10, or even 15 years down the line due to bone loss, mechanical stress, or infection. Studies show that about 5 to 10% of dental implants fail within 10 years. That means if you get an implant today, there's a real chance you'll need additional procedures in the future. Sinus problems, the unexpected complication. If you're getting an implant in your upper jaw, listen carefully. Your upper jawbone sits very close to your sinus cavities. When an implant is placed in the upper jaw, especially in the back molar area, it can actually penetrate into the sinus cavity. This is called sinus perforation. What are the consequences? Chronic sinus infections that won't go away, constant pressure and headaches, difficulty breathing through your nose, post-nasal drip that causes coughing, bad taste in your mouth. Treating sinus perforation often requires additional surgery to repair the sinus membrane and might mean removing the implant entirely. Some patients need to see an ear, nose, and throat specialist for months or even years to manage ongoing sinus issues. The prevention, your dentist might recommend a sinus lift procedure before placing the implant. This involves adding bone material to create more space between your sinus and jawbone. While this can prevent perforation, it's an additional surgery with its own risks and costs. The financial burden, more than you bargained for. Let's talk about something nobody wants to discuss: the money. A single dental implant can cost anywhere from $3,000 to $6,000, and that's just for one tooth. If you need multiple implants, you're looking at tens of thousands of dollars. But here's the hidden cost. If complications arise, you'll need additional treatments. If the implant fails, you might need bone grafting before trying again. Sinus lift procedures can add $1,500 to $3,000. Infection treatment and antibiotics, time off work for recovery and follow-up appointments. The alternative costs. Before committing to implants, consider that bridges and dentures are significantly cheaper and have fewer complications. A bridge might cost $2,000 to $5,000 for 3 teeth, and dentures are even more affordable. Yes, they're not as permanent, but they're also not as risky. Long-term maintenance, the lifetime commitment. Getting the implant is just the beginning. Many people think that once the implant is in place and healed, they're done. Wrong. Dental implants require serious maintenance for the rest of your life. Daily care, you need to brush, floss, and use special interdental brushes around the implant every single day. If plaque builds up, you can develop peri-implantitis, which we mentioned earlier. This is like gum disease but around the implant, and it can cause bone loss and implant failure. Regular checkups. You'll need to see your dentist every 3 to 6 months for professional cleanings and monitoring. These visits aren't optional, they're essential for catching problems early. Potential replacements. The crown that sits on top of the implant, the visible tooth part, typically lasts 10 to 15 years before it needs replacement. That's an additional $1,000 to $3,000 every decade or so. Lifestyle limitations. If you're a teeth grinder, you'll need to wear a night guard forever. If you play contact sports, you'll need extra protection. Hard foods like ice, hard candy, or nuts can damage the crown. Conclusion. So, should you get dental implants? Look, I'm not here to make that decision for you. For some people, implants are absolutely the right choice. They work wonderfully and last for decades without issues. But you deserve to know the complete picture before making such a significant decision. Here's my advice. 1. Get a second opinion from another dentist. 2. Ask your dentist specifically about your risk factors. 3. Discuss all alternative options thoroughly. 4. Make sure you understand the total cost, including potential complications. And 5. Think about your lifestyle and whether you can commit to the maintenance. What you should do right now? If this video helped you understand dental implants better, please hit that like button and share it with anyone you know who's considering this procedure. Knowledge is power, and making informed decisions about your health is crucial. Drop a comment below and let me know. Are you considering dental implants? Do you have any questions I didn't cover? I read every single comment and I'll do my best to respond. And if you want more honest, educational content about dental health and medical procedures, subscribe to the channel and hit that notification bell. I post new videos every week to help you make the best decisions for your health. Thanks for watching, take care of yourself, and remember, your health is your wealth. I'll see you in the next video.